Hi everyone, I hope you're all doing fine. What we're gonna show to you right now is a set of two clinical vignettes and its associated review stems. And we're gonna learn how do you approach a clinical question, how do you understand it, how to answer it correctly, even if you don't know anything about it, and how in the world do you learn to annotate what is being given in those long, long paragraphs without wasting much of your time. This is a detailed video. Please watch it to the end, and I hope you'll like it and it'll be worth your time. Thank you and all the best. So, the first question is that a 20-year-old man is brought to the emergency department due to a day of fevers, headache, and neck pain. No significant past medical history. You have been given the temperatures, fever is there, BP is normal, and pulse is slightly on the higher side. Respirations are also high. And on a physical examination, you have neck stiffness and a truncal petechial rash. And you have been given the CSF findings as well. And you have also been told that yes, CSF gram stain is showing you a gram negative diplococci. And in the emergency department, they have told you that the hemodynamic status has been depleted rapidly and his BP has been dropping and he's starting to bleed. And they have asked you which of the following findings is most likely to be seen on this patient. And yeah, you have six options. The first way is that you just read through the question like just I did, and then you scroll through all the options and waste a lot of time, right? Well, this is not the right approach when it's going to come to your examinations. What you should do is you should just go through a quick algorithm. First of all, make sure you always highlight the age of the patient. In this case, it's 20 years. Then read the last line of the question. Yes, they have clearly asked you that which of the following findings is most likely to be seen. So they are asking you findings. What findings? You go through the answers. They are giving you a number of cells. Well, if you have read this topic, acanthocyte, bite cells, cystocytes, spherocytes, they all are different pathologies of red blood cells only. So the question is just asking you to make a provisional diagnosis and identify what's going to be the answer. Most of the clinical questions would always have some filler information just to distract your mind. Make sure you do not get distracted. Now, let's say in this case, giving you the CSF analysis is a filler because they've already told you that the bacteria is a gram negative diplococci. If you have been given a CSF analysis and if you have no clue about this question, you can actually understand that okay, I have a bacteria. I have been given that the patient's BP is dropping rapidly, and you also have fever. What can be the common presentation? Basically, something related to brain infection, fever, meningitis, right? And yeah, that's correct. The answer is meningitis. You have the provisional diagnosis, and they're asking you what can happen because of meningitis. Now, meningitis has a lot of complications. You can have altered mental status, you can have so many complications. The question is not asking you to be a clinician and go down and just rule out all the possible differential diagnoses and then drive to an answer. They obviously know that yeah, you are in second year or maybe you're in your third year, and it's not practically possible for you to sit there and rule out all the DDs in just 30 or 50 seconds. So what you do is you think according to what's given in the options there. In this case, the buzzword for your question would be bleeding from the venous access sites. Well, this is a highly important word. This is the hallmark feature of disseminated intravascular coagulation, DIC. And this line is given in the first aid exactly as it sounds. So even if you didn't know anything, had I been you, what would I have done? I would have seen that, yeah, okay, the patient is 20 years old and he has some symptoms of fever, headache, and neck pain. All right. He has fever as well. And I have been given the CSF analysis. Probably it's meningitis. Even if I didn't know what the bacteria was, I would have known that this is Neisseria because it's the most common bacteria to cause basically meningitis in this age group. Although, nevertheless, they have given that yeah, this patient has been infected with a gram-negative diplococci. It confirms that yes, this was Neisseria, but this info is not required. What you just need is that okay, this patient has been infected and this patient has septic shock because his BP is deteriorating rapidly. You just don't need to know that what's the etiology behind septic shock, right? if you have been asked that, yeah, what is the bacteria or what is the pathogenesis of a septic shock, that's when you would be thinking along those lines. The question is simply asking you what's going to happen. So all you know is you have a 20-year-old patient, okay, and he is suffering from septic shock, and the reason that he's suffering from septic shock is Neisseria, but you don't need that information. Then he has given you clearly that he is starting to bleed from venous excess sites. This one word just tells me that, okay, if a patient is suffering from shock and is bleeding, the answer is DIC. So the only takeaway point that you have to note from this question is that bleeding from the venous excess sites is a buzzword for disseminated intravascular coagulation. That's it. That's all the entire question. Which of the following findings is most likely to be seen? Well, what is the hallmark finding? The answer is cystocytes. Option number C. This is the first step to solve a question. But the game's not over yet. You need to also understand why the other options are wrong. Acanthocytes. Acanthocytes are associated with A beta lipoproteinemia. There is no history of any fat malabsorption. So the first answer is incorrect. Bite cells. Bite cells is a classic feature of G6PD deficiency. What's the common presentation of G6PD deficiency? Well, the answer is, any drug history, sulfa drugs, primaquine, um, isoniazid. Any history of intravascular hemolysis? No, no such history. You have been given a typical history of shock after infection and bleeding from venous excess sites, suggestive of DIC. Schistocytes, yes, because whenever there's a thrombus, the RBC is gonna splice into half whenever they encounter a thrombus or a mechanical obstruction. So schistocytes is an answer. Spherocytes, well, spherocytes are possible if the patient has an autoimmune etiology or when the patient has hereditary spherocytosis. None of the diagnosis is consistent with this presentation. Hereditary spherocytosis has basically, you would be given a history of hemolysis. The MCHC would always be high. You would have been given a CBC count. You would have been given a blood profile, but it's not given. You're just given a CSF analysis. That is also not important for this question. Target cells. Target cells are seen whenever there is a high surface area to volume ratio. It can be seen in iron deficiency anemia. It can be seen in sickle cell anemia. It can be seen in thalassemias. And again, the history does not match with this diagnosis. Teardrop cells is a buzzword for myelofibrosis. So yeah, see, I have done my step one. I have the knowledge to eliminate all the options. But this question does not want you to eliminate the options. This question was simply that, yeah, you know this word, bleeding from venous excess sites. And yeah, you know that in DIC there is cystocytes. Bang, the question is solved. All the other information which is given to you, it's all filler. So that's the way you need to dissect a question. That's the way you need to understand how do you mark the key points and solve the question in. For any question, the step to approach these questions is often multidisciplinary. You need to work through a lot of things before you arrive at a final diagnosis. Well, for the last question, first of all, you needed to figure out that the patient was suffering from meningitis. Then they told you about the hemodynamic status, so you figured out that, yeah, the patient was suffering from septic shock. Then you figured out that he was bleeding, so the possible diagnosis could be DIC. And then they asked you the finding of DIC, which is schistocytes. Make a timeline and write these four steps. Now, figure out where did the question go wrong. Could you not make the diagnosis of meningitis? Could you not make the diagnosis of septic shock? Could you not make the diagnosis of DIC? Or you didn't know that schistocytes were a feature of DIC or any obstructive pathology. Based on your answer, read the question again. So, in case you didn't know about meningitis, then this question was not for you. You need to first of all understand how meningitis presents to you. You need to understand the CSF findings. You need to differentiate between the various signs and symptoms of meningitis. And even though that information was not needed to solve that question, but still, while you review that question, you have to make sure that you know every possible information that was given in that question. Maybe it's filler or it's non-filler information, does not matter to you. Once you've solved the question, do not just fast forward the topic that is the question right or is it wrong. Just understand that now that you've solved the question, you need to derive maximum info out of it by reading the review step. So the first concept that was highlighted in that question was of meningitis. Make sure you know meningitis correctly. The second concept that was highlighted in that question was of septic shock. Make sure you know septic shock correctly. The third concept that was highlighted was of DIC. Make sure you know about pathogenesis and all that stuff. The fourth concept was of schistocytes. Make sure you know all the diseases in which schistocytes are seen. All these four things are super high yield. Now let's read the vignette, the review stem basically. They have given you meningitis, then they told you about bleeding from venous puncture sites, then they told you some information about sepsis, and then they told you why the other options were wrong. The exact process that we worked out, right? And what are the points that you need to write from this vignette? The question was focusing on DIC and schistocytes, and we solved the question just by one word, which was bleeding from venous puncture sites. You just take this word and jot it down in your notebook. Rest all is history. That's the rest of the information. You can drive it out if you have your basics strong, and the rest of the information is already given in your first aid. The new information, which was to be taken home, was bleeding from venous puncture sites and the concept of schistocytes. Now, coming to the options that were wrong, you might have gone through those topics, or those topics might be new to you. If you have already gone through the topics, read through those statements, and whatever you don't know, write it down. But in case some topic is new to you, my approach would be, please do not write that information at that point of time, because that is completely against the idea of just dissecting the information, and it's completely against the idea of learning by conceptualization. I don't want you to cram anything. If you have this point which is new to you, just star mark that point and just put it down somewhere in your notebook, or if you do an offer an annotation, put it down separately. When you come to that topic, that is the time you go through that point again, and if that point sounds very obvious to you, do not memorize it, and if that point sounds new to you, write it down in your fair notebook. That's the right way to review a question. And let's go to the next question now. I'm not going to read through the second question for you. We're going to use the algorithm that we just learned. So, first of all, I told you read through the age, 1 year old, and we have also been told that he's an African American. See, a lot of questions can be solved if you know the epidemiology. I said then lead through the last line. Physical examination shows bilateral severe swelling of hands and feet, and which of the following is most likely abnormal. So, okay, what is that thing which comes in your mind when you read through this vignette? You have a 1 year old patient who is African American. This is very important, and he has his hands and feet swollen. Most probably, he would be in pain as well. I'm extending this information, and when you read through the question, yes, the patient is crying when his hands and feet are touched. That means he is in severe pain. So this is the most common presentation for sickle cell anemia, dactylitis, right? So now you read through the options. Left ventricular systolic function, albumin, C for complement, haptoglobin, venous pressure, cortisol. You know that sickle cell anemia is associated with hemolysis. And whenever you have hemolysis, basically intravascular hemolysis, what is that one thing which is affected? The answer is haptoglobin. Option number D, the question is finished. So, what did we learn from this question? The first thing that we learned is the importance of age and epidemiology, which is oftentimes given in the first lines. Then we learned that you have to read through the last lines. Most of the information, by my experience, is always given in the last paragraphs and in the last few lines of the question. So if you just read through the last lines, 90% of the times you would be able to derive at a diagnosis by skipping the entire vignette. Then you go through the options and try to derive your probable answer. And if it makes sense to you, go ahead with it. Most of the times, there is not even a need to double check your answer. Your single best guess is often the correct answer, because on the actual exam, you have practiced a lot of questions. A note on UWorld, that UWorld contains a lot of information, and it's not at all possible to memorize every single point given there. UWorld is a tool that teaches you how do you solve questions. It's a tool that would help you to formulate your own approach to solve a clinical vignette. Like no one told me that you go this way. This is by my own experience. UWorld is also going to teach you the points that are not given anywhere else. And that's why I stress, please read your first aid very nicely before approaching a Q bank like UWorld or any other Q bank, because If you spend your time memorizing information what is already given in your basic textbook, that way you would not have time for developing these skills. Now, coming to the review stem, well, we follow the same approach. First of all, understand what you already know, and then try to link the information with the new information given in the review stem. So, first of all, let's make a timeline. You have been told about hemolysis, intravascular and extravascular. You have been told about a marker that can differentiate between the two things, which is decreased haptoglobin. Then you have been told about vaso-occlusive symptoms, and you have been told that the most common symptom here is dactylitis, and it also happens to be the common presenting complaint of children. Now, what is that? What is the point that you can understand from here? You can understand that dactylitis would never ever present in an adult as far as competitive exams are concerned. So whenever you have dactylitis, feel free to assume that yeah, it's going to be a child. In adults, you can have other diseases like pain crisis, acute chest syndrome, leg ulceration, etc., etc. Then they told you about some infections, and the encapsulated organism point is pretty much obvious, so you do not need to annotate it. The only point that you need to take home is the fact that dactylitis occurs commonly in children, and decreased haptoglobin is a marker of intravascular hemolysis. Regarding the points that were not right, um, the point of chronic anemia and sickle cell disease is worth noting, how it can lead to cardiomegaly. You need to understand that process. And you also need to understand how often and in which patients it can occur. Let's say they have said that it does not occur typically after infancy, it occurs mostly in older patients. So, this cardiomegaly thing would most likely to be present in your older patients. Your children would never ever present with chronic anemia and sickle cell disease. Albumin and urine cortisol levels are completely out of the box. You need not annotate these points. And then hereditary angioedema, it's a completely different topic from from sickle cell disease. And if you don't know something about it, you can write it there. But this point, if you have read your first aid well, is also a pretty much obvious point and need not be annotated.